So we've now come to the end of the three presentations in this section. And what we're going to do now is to have some question and answer discussion with the speakers. So I've got a range of questions that people have already submitted during the conference session this morning. If you've got more, please do add them to the Zoom chat so that we can try and pick them up with the speakers. I've got a question first for Dr. Phoenix Mo about her data on the Hong Kong epidemic and the COVID impact. I think people are interested to know, you presented some data showing that some MSM have had higher risk behavior for HIV during COVID, but others have had lower risk behavior because they're taking more precautions. Do you think there's a way to estimate what you think the overall impact has been on the HIV epidemic? So I know this is not very easy to do, but I suppose do you have any observations about the numbers of MSM who've been responding in different ways in your study, and how it might be impacting the overall epidemic in Hong Kong?
Yeah, thank you very much for the questions. I think this is certainly an interesting questions, and this is something that we want to look at as well. So yeah, we see that actually the COVID-19 period may bring some challenges, but some of the mitigation strategies adopted by the MSM may have been a protective factors for the sexual behaviors as well. So I think, yeah, that's true that overall the effect on the MSM seems to be vary, and there may be some individual differences. But overall, we seems that in terms of the partner selections and also the risky sexual behaviors in general, when we just look at the numbers and the patterns, there is a degrees in sex and degrees number of sex, but yeah, in return maybe more risky sexual behaviors like condonus use. So I think overall, yeah, how these would contribute to give overall pictures of their sexual behaviors is something that we can we hopefully will be able to see. So I think our future our step is to try to look at to identify whether there are any specific factors, okay, that would explain the high level of risk for the MSM, and there are any particular behaviors that is in general may be a protective factors for the risk behaviors. Yeah, so I think, yeah, we can look at these together, yeah, in terms of sexual behaviors and HIV testing, and hopefully present a more comprehensive picture. Yeah.
Thank you. Thank you. So I was interested, there's a parallel, I suppose, with financial markets and economic crises that have been going on. People talk about the shock that there's been from COVID, so how it's changed the ways countries do things and the way people plan their economic policy and so on. And I suppose what we're asking, partly in the HIV world, is has there been a shock from COVID to HIV prevention, to stop transmission chains? Is it temporary or is it longer term? I think you touched on that in your presentation, because you talked about whether the drop in HIV testing rates, for example, is temporary or not. I mean, how long do you think it will take us to be able to see what is the longer term effect?
Well, I think for the longer term effect, yeah, I think it would best like if we were able to follow them up for a longer period of time to see whether there are any significant changes. But when we look at the data, it seems that behavior change is highly depends on the measures, okay, that the Hong Kong has been in place. So like the closures of venues, the contextual factors, they really have an effect. And we also see that COVID-19 perception is significant factors as well. So I think these two are the important things. So I think it's yet to see how the the COVID control measures is going on in Hong Kong. And I think as long as the COVID has been here for a long time, and people's perceptions on COVID-19 has been changing, especially now we have gone through the 5th wave. So it's changed a lot of perception of the MSM. So these perceptions change may also lead to a change in their testing behaviors as well. So I think, yeah, we will see that in the longer term, we may see a change in their HIV testing behavior. So yeah, and of course, yeah, it would be good to have more data to support this in the future.
Thank you very much, Dr. Mo. Okay, I'd like to ask Dr. Stefan Koo a couple of questions from the audience. The first one is, someone is interested in, you mentioned the possibility of pharmacological intervention for chemsex users. And one of the participants wanted to ask more about this and how does it work and what might the connection be to psychiatry services? How does it work? So I wondered if you could talk a little bit about that. And then the second question for Dr. Koo, I wanted to ask about slamming, so injection of crystal meth. We had a presentation from Dr. Wong Kar-hing this morning at the Centre for Health Protection, and his data was saying that 5 to 10% of ChemFund users in Hong Kong report that they have used slamming. And I wondered what you thought might be, is slamming growing in Asia? And what do you think the implications are of it for the way that we need to develop our interventions? So Dr. Koo, could you maybe comment on those two things, please?
Thank Andrew for this really brilliant and very important questions. The first one is, a lot of people are very, they thought that from the data that there will be very promising pharmacological therapy for crystal meth users. But actually, we have to emphasize on that the paramount of the treatment is mainly on counseling and cognitive behavior therapy, because there's no really specific replacement therapy as we see in the opioid dependence disorder in the past. So these are just several of the candidates which have been shown effective in addition to standard counseling. They have decreased the chance that people using crystal meth. So these are like a juncture therapy to the daily management of our patients. So and also apart from what I introduce these two combination, mirtazapine and also long-acting naltrexone, there are other atypical antipsychotics have been tested and in the clinical trials nowadays. So not just only these two options, but other antipsychotics are also being tested. For example, like in our daily clinic, our psychiatrists will use Abilify, another drug, to decrease people's craving in order to get these similar effects. So I think there's still a lot of, they're not perfect. They are part of the treatment, but they are not all. So still we still rely heavily on traditional CBT and also other interventions. But it's good to know that we have new candidates or new treatment options, and which might add more weapons to this management. And for the second question, I think this is a very, very good one. Also, in general, we will see that the prevalence of chemsex, not really specifically saying slamming, but chemsex is pretty stable. In our study in Taiwan, that we see is always around 6 to 8% people in the past 5 years. So in general, it doesn't really change a lot. It still remain the subgroup, practice among subgroup of GBSM. However, we do see that slamming become more a preferred route of using crystal mass in the past few years. There might be a lot of explanation. For example, the price of crystal mass was becoming really high nowadays. So slamming would probably save money. And then also, once people are more prone to, they're familiar with slamming, they might start using crystal meth by slamming instead of going from smoking, snorting to slamming. So a lot of first-time users of crystal meth, even in Taiwan, are experience slamming as well. So we do see this kind of trend. So that's why we feel that needle exchange services is very important. Also, we need to incorporate other interventions we used to have for people with injection drugs to our GBSM communities.
Thank you, Dr. Koo. I'd like to turn then to Dr. Wong, if I may. So I was really interested in your explanation of the data and the modeling. And I know that you've got some expertise in particular in southern China. So I wanted to ask whether there is, you see similarity in the heterosexual epidemic in southern China as in Hong Kong. As to begin with, that's the first question. The second question I wanted to ask is really to do with the way that community organizations intervene in the community to educate and support heterosexual people at risk of HIV. So we've got this very large population group of heterosexuals, and we need to find the people who are most at risk. And I wondered if you had any thoughts to advise organizations on how they might best do that using the data and modeling that you've described. So maybe Dr. Wong could comment on that.
Thank you, Andrew. For the southern China, previously I mainly focused on MSM instead of heterosexual population, but from my understanding of the similarity on the HIV preference among female sex workers in at least Guangzhou is also very low, near zero as well. And so that may be one of the hints showing that the transmission pattern might be also heterosexual is also not the main route of transmission in at least Guangzhou city. And for the community that is in the community in Hong Kong, yes, the population size of heterosexual is very, very big. It is the general population. And so that maybe we should target at those maybe at higher risk of HIV infection, such as because non-local transmission is one of the key. So maybe for those persons who are having a more frequent traveling, I'm not sure. And also for people like domestic helper, I understand that the governments previously, maybe a few years ago, they have conducted a survey among domestic helpers and showing that actually their HIV testing rate was very low, and their awareness on the HIV testing facilities and supports in Hong Kong maybe not very high as well. So I'm not sure whether this is one of the hints for us to maybe further enhance, at least let them know the availability of the facilities in Hong Kong where to find free testing, and the availability of free self-test kit maybe, and also the condom as well. I hope that this viewpoint is useful.
This is very useful. Thank you,
you.
Dr. Wong. So I've got a question from Dr. Nathan Tan, who wanted to thank all the speakers for their presentations. He wanted to get some insight from the speakers on mental health impact due to COVID on sexual behaviour, substance use and healthcare test-seeking behaviour. So his question is, to be better prepared and mitigate for the coming waves of COVID, what are your thoughts on integrating mental health into the overall HIV prevention strategy? Maybe I could ask Dr. Koo to comment and then maybe see whether Dr. Mo wanted to add to it. So on integrating mental health into the overall HIV prevention strategy. Maybe Dr. Koo could go first.
Yeah, very good question. We definitely think we need this kind of service, and so far actually it wasn't being part of the services. We do have telemed services providing for people who were confined in their homes while having infection or doing isolation. But a lot of time there was no psychiatric doctors who doing so. So definitely this is something we're lacking. For people who do chemsex, for example, we as from our survey, you do see that most of people are decreased use chemsex or having less sexual life, or at least being less active like during the COVID lockdown in Taiwan. However, in the psychiatrist clinic, there are a subgroup of people who actually use more drugs or do more chemsex during COVID because of the economic impact they have. They might lose their job and they turn to use drug more frequently. So we definitely see there a small population who probably need more attention, and especially during epidemic.
Thank you. Dr. Mo, did you want to add anything? I think quite a number of your questions in your study did look at some of the mental health impact.
In our study, we are actually trying to look at the mental health impact and how the COVID has an effect on their psychological and social health in general. So we find that a significant number of participants they encounter different aspects of mental challenges and also the psychosocial challenges as well. So for example, feeling depressed, anxious, worry about the COVID, and also worry about the impact that the COVID will have on various aspects of their life. And also they report some loneliness and social isolations. I think these are some of the significant issues that we have seen in our survey, with regards to their psychosocial and mental health. And overall, like the literature suggests that mental health is related to their sexual behaviors as well. So we do believe that if we try to have the interventions for sexual behaviors, we should also target the mental health, or at least to address the issues on, for example, anxiety and social isolations or loneliness. And because the overall literature, there is a lot of findings suggesting that there is a significant association between these factors.
Thank you very much for that. We've come to the end of this session, so I'd like to thank very much the three speakers for three excellent presentations, which give us a lot of data and information about the current Hong Kong HIV epidemic and some associated factors that I think can help inform our planning for service interventions in the coming years. So thank you very much to all of those speakers. We're going to now go to a break. So we'll be back at 11:25. So still, please stay tuned. We're going to be having a sofa chat style discussion. Because we're virtual, it's not going to be one sofa, people are in different places, but we've got some really interesting discussion looking back at what's happened so far in the HIV epidemic, and also hearing from some really eminent speakers about what do we need to do next to get to 0 new infections by 2030. So please join us at 11:25. Thank you very much.